What is the recovery like from parathyroid surgery? I'm Dr. Babak Larian from Center for Advanced Parathyroid Surgery. Well, the one certainty in recovery from hyperparathyroidism is bone pain. So if you have bone pain, it's caused because PTH, or parathyroid hormone, is going into your bones and telling your bones to release calcium on a constant basis, right? And that causes achiness in the bones. And so almost immediately in the recovery room, the bone achiness, the bone pain stops because the PTH levels drop. And so that's the one constant. Everything else is less consistent and less predictable. By that I mean all the other symptoms, including fatigue, memory issues, the brain symptoms, anxiety, depression, irritability, the muscle issues, the muscle weakness, which causes generalized weakness, but also causes bladder issues where the bladder doesn't empty all the way, so you have frequent urination and nighttime urination, intestinal issues with acid reflux and constipation. All of those things can take longer, and that's because they're not immediately caused by PTH alone, right? They're caused by a complex set of changes that happens in the body when your calcium is constantly elevated and PTH is constantly elevated, and your body keeps having to adapt to these higher calcium and higher PTH numbers, right? And as your body adapts to these things, right, it also, your organ systems adapt to each other, having adapted to higher numbers. So it's a complex network of adaptation to new challenges, right, in your body. And so once the calcium and PTH comes down, those adaptations have to rebalance back towards the normal, right? Which is a new normal now for the body. In any case, so what I tell my patients is the length of time it takes for you to feel dramatically better, right, in these symptoms really has to do with how long you've had hyperparathyroidism, right? So the longer you've been in the hyperparathyroid state, the longer it will take for you to adapt back. And how different is your now elevated calcium level during hyperparathyroidism to the calcium level that you normally existed in? So if the gap is wider and the length of time is bigger, it's going to take you a longer period of time to get back to normal or get the symptoms to alleviate. Now, I send surveys for my patients, right? Before surgery, immediately after surgery, 6 months after surgery, a year, 2 years, and 4 years. And I really do see that there is a progression, right? And at 2 years, patients are better than 1 year. And interestingly, at 4 years, they're even better than the 2-year mark. So it is a process that progresses over time. So if you're not feeling significantly better, don't lose faith. What I encourage you to do is to challenge your body. Be more active. Do activities that are different than what you would do normally so that you have different forces of adaptation on your body. Exercise your brain. Do memory exercises, crossword puzzles, memory games, and so on and so forth, so you can challenge your brain into adapting and getting back to normal. For some people, all of this is immediate. So I'm sure a lot of you have seen online, someone says, I had a parathyroid surgery and I feel like $1 million the next day. And that does happen. Unfortunately, that's not the routine. It happens sometimes. It's exceedingly gratifying as a doctor to see that, because you can immediately see how much you've helped someone. But it's not the routine that happens. Usually, it takes a long time before someone discovers they have hyperparathyroidism, and therefore it takes a while for the body to heal and repair itself and adapt to the new normal. If you're interested in clear parathyroid information, visit us at parathyroid.net. Be well.